If you are studying for NCLEX, you need to know the difference between hyperthyroidism and hypothyroidism because these questions are not just about memorizing symptoms. The exam wants to know if you can recognize the pattern, connect it to metabolism, and catch the safety risks. And if you forget the post-thyroidectomy complications, you can miss easy points. Let's break it down. Let's start with hyperthyroidism. Hyperthyroidism means the thyroid is overactive, so the body speeds up. Think of it as too much metabolism. For NCLEX, the pattern is fast, hot, loose, and overactive. The patient may have weight loss, heat intolerance, sweating, tachycardia, palpitations, anxiety, tremors, and diarrhea. They may also have increased appetite but still lose weight because the body is burning energy too fast. Some patients with Graves' disease may develop exophthalmos, which means the eyes appear more prominent. Nursing care focuses on reducing stimulation and supporting the patient. These patients may need a cool environment, rest, adequate nutrition, and monitoring of heart rate and cardiac symptoms. Common medications include antithyroid drugs such as methimazole or propylthiouracil, and sometimes beta blockers to control symptoms like tachycardia and tremors. Now, here is the high-yield NCLEX point: post-thyroidectomy care. If a patient had a thyroidectomy for hyperthyroidism, you need to watch for airway compromise, bleeding, and hypocalcemia from possible parathyroid injury. A major post-op concern is respiratory distress. Keep the patient in semi-Fowler's position, monitor the neck dressing, and watch for swelling or signs of bleeding. It is also important to keep a tracheostomy set, oxygen and suction available. Another big clue is hypocalcemia, which can happen if the parathyroid glands are damaged. Watch for tingling around the mouth, muscle cramps, tetany, and positive Chvostek's or Trousseau's signs. And one more emergency: thyroid storm. This is a life-threatening complication of severe hyperthyroidism. Think fever, extreme tachycardia, hypertension, agitation, and possible heart failure. This is an emergency. So when you think hyperthyroidism, think fast heart rate, weight loss, heat intolerance, tremor, diarrhea, and possible thyroid storm. Now let's switch to hypothyroidism. Hypothyroidism means the thyroid is underactive, so the body slows down. Think of it as too little metabolism. For NCLEX, the pattern is slow, cold, tired, and heavy. The patient may have fatigue, weight gain, cold intolerance, constipation, dry skin, bradycardia, depression, and slowed thinking. Hair may become coarse or thin, and the patient may look puffy. So while hyperthyroidism speeds everything up, hypothyroidism slows everything down. Treatment usually includes levothyroxine, which replaces thyroid hormone. This medication is often taken for life. A key teaching point is to take levothyroxine consistently, usually on an empty stomach, and not to stop it suddenly without guidance. A severe complication of hypothyroidism is myxedema coma. This is a medical emergency. Think decreased level of consciousness, hypothermia, bradycardia, and hypotension. So the quick breakdown is this: hyperthyroidism, think of body too fast. Hypothyroidism, remember body too slow. For NCLEX, if the patient looks hot, restless, tachycardic, and losing weight, think hyperthyroid. If the patient looks cold, tired, bradycardic, constipated, and gaining weight, think hypothyroid. And do not forget, if the question mentions a patient after thyroidectomy, think about airway, bleeding, and hypocalcemia. That is the pattern you need. Nursing students, stay focused, think safety, and pass the NCLEX.